Well, good evening, everyone. I think we'll go ahead and get started and let people straggle in whenever they get a chance. So I hope everyone's doing well this evening and haven't gotten too overwhelmed with work and other things. To begin with, we've got some people that wanted to provide some disease updates, and then we'll go through some case presentations. But so Ralph, since you're on the line, can you go ahead and start us off, please?
Sure, be glad to. Thank you for the opportunity to share all the fun we're having around the state. Want to start out with warning everybody that has anything to do with horse clients or talks to horse people. We've had our first 2 confirmed West Nile cases in horses, 1 over in Tucumcari, 1 down in Deming. We have 2 from up around Raton that are suspect with titers, but they didn't run the IgM, so they're not confirmed. But the mosquitoes are coming out. We need to make sure everybody's got their horses protected for the mosquito-borne diseases, and West Nile is definitely one of those. We have been blessed so far to avoid vesicular stomatitis this year. We've had a couple cases that were suspect and tested negative. We have blood out today on a horse down in Riodoso that turns out it was brought in from Texas. Veterinarian couldn't be bothered to do the follow-up on the mouth lesion, so he went ahead and signed the CVI and sent the horse anyhow. So we're working on sending him a warm greetings from New Mexico right back at him. If you're going to bother to look at a horse, pay attention to what you're seeing, or whatever it is you're writing a CVI on. Do the exam, point out the shortcomings, and move on. But this is, if this thing comes back positive, which we hope it won't, will be the lucky index state once again for VS for the year, and we'll be dealing with quarantines and trade issues instead of Texas, where the horse originated. So a little aggravated that they didn't do what they were supposed to do. We're still dealing with M. bovis, bovine TB, have 4 herds under quarantine. We did release one of the herds back in May. They hadn't produced a positive yet after 7 tests, and had a visit with some of the federal epidemiologists, and they agreed that this herd wasn't a risk, and we went ahead and released them from quarantine. We'll start their first annual assurance test in November. We've got basically 25,000 head under quarantine at this point. There appears to be no more depopulation in an indemnity. We're forced to test and remove. We've just completed our 8th test and removal on this complex for 3 of the herds. One of the herds has just completed its 4th test. So 3 herds associated in the same complex and 1 herd distant. Both of them with novel strains not seen before in the U.S., which always makes us suspicious of where it's come. I don't know if any of you have seen any of the new information out, but there's been a couple ties between human transmission to cattle of M. bovis. They pretty much locked it in on 3 recent history cases and working up a few more. So a concern not just on cattle to cattle transmission, and not just cattle to human transmission, but human back to cattle. So something we're looking more into. We've had some issues with the rabbit hemorrhagic disease virus. It's far quieter this year than it was last year. We haven't had a confirmed active case since June. We're still hearing rumblings that it's out there, but once we were declared endemic, USDA quit paying for the testing. So we're not getting a whole lot of voluntary cases where the owner's willing to pay for the testing. So I don't know that we're not having as much of it, just as much as it's not being reported. We had some issues. We had a load of vaccine come in from France. Once we got hold of the temperature tracker, it had gone above required temperature limits for 24 hours before it got here. We started distributing it and then got the printout on the temperature tracker. So we are working on getting a claim put through to replace the lost doses, and we're basically out of vaccine in New Mexico right now until we get this resolved. So another frustration. There is a private company working on trials now for efficacy. Hopefully by spring of next year, it's possible that we may have a domestic produced vaccine that would be licensed for distribution in the US. So anybody that wants it could purchase it and would take us out of the middle of the rabbit hemorrhagic disease vaccine business, which would be a wonderful thing. But that's about it. Happy to answer any questions if there are any, and everybody be safe out there.
Well, I don't think there's any questions. Thank you, Ralph. Tim, did you want to provide any updates?
Yeah, I'll do a real quick one as long as Dr. Edistat's not listening. I think most of you know I've switched gears and I'm trying to follow in big shoes, and I'm into my third week as a state public health veterinarian. The only thing that I was going to report on is that you all might have seen already that we had our first human case of plague last week. Fortunately, the patient did well, responded to treatment, and is back home. But what I was going to throw out to you all is, we went out and did some surveillance and trapped some mice and rats and have submitted specimens and fleas to CDC. But I also bled the dogs while I was out there. They had 4 of them. Or 5, I'm sorry, and thought we would do titers just for some surveillance. And so I took blood and submitted them and got results back. And so my question to you all is, what would you do with these results? And now these are happy, healthy dogs. There were 2 Labrador Retriever puppies, about 6 months of age. They had titers of 128 and another one was 256, higher than that. Bottom line is all 4 of the 5 had significant titers. And so that came across my desk. And so the question is what would you all do? I'll just throw it out there and then I'll tell you what I did. So, and Dr. Edistat, you can't cheat and help. We have an active bunch. What's that?
Flea control. Make sure that there's no fleas on the dogs and that there's no fleas in the house. And
yeah, and so we had a long talk with them about that, and where they're at, they're going to have a very hard time controlling the rodents. But yeah, we discussed flea control at length. I guess my question is, with titers like that and with positive human, would you all have, with a single titer, would you have put them on antibiotics? Would you have treated them?
I would say no. I guess I wouldn't at this point.
Yeah, and that's what I said too. And that's what we they're healthy. There's no fever. There's not anything else going on. So yeah, did not treat. I mean, very significant titers. And one of the people said that they were shocked at those titers, and my response was, I would have been shocked if we didn't see titers with the situation that we had. But no, so I did not treat, and hopefully they'll let me go back out and do some convalescent work. And if Dr. Edistat wants to chime in, I'd love to have an opinion there. But But as far as from Department of Health and with my 2.5 weeks in, that's been it. I'll be getting all my information out to you all here shortly, hopefully by the end of this week. And same thing goes. If you ever need me, you all know that I always have my cell phones with me and I monitor email. So we'll go from there. So Paul, you want to add anything?
Oh, sounds good. Did a good job.
Tim, are they going to let you do convalescent titers or multiple titers down the road?
I hope so. They came in right at the end today, and so we haven't had a much of a discussion. If they're going to let me go back out and do it. The owners are very compliant. They've been very helpful, so we have to get the okay from them also. And if they do, I'll let you all know on our next get together.
Yeah, that'd be great. Thank
What
you.
did the risk look like around the home to the other people in the family?
What did the risk look like? What do you mean, Paul?
Did you find like active fleas and rodent burrows
Yeah.
near the home where they could potentially be exposed?
Yeah. Yes. I mean, we set our traps. I mean, it's mouse haven, just to say the least. Lots of loose rock, lots of debris, lots of junk around the house and not far from it. So yeah, I mean, lots of places. I mean, we with our little short time, we collected 20 mice and 1 rat that we processed. So, and that was just setting the traps once. So, but yeah, there's lots. So.
Were they deer mice or house mice or?
Yes, we had 2 house mice. We had deer mice. We had 4 different species. So yeah, combination. And and what was interesting is we actually found quite a few fleas on the rodents. And as the newbie of the bunch, and the way it's explained to me is that they didn't expect to find that many fleas. Liz Van Hatten and Lisa Drake are very, very good at this, and they kind of walked me through it. So
any fleas on the dogs?
Did not find any. I looked the best that I could, went through, but active jumping Labrador puppies, trying to look, and they certainly could have had something, but did not find any. But I would bet that the short answer though would be I'm sure they're there. I'm sure that at least intermittently they're going to have fleas.
Do the dogs sleep in bed with the people?
Bingo.
Yeah.
Yeah.
Always. That's always it.
Yeah. Yeah.
Yeah.
So do they test the fleas for the plague? Is that what they do?
Yes, we got blood and the fleas. So the fleas go, and they will test the fleas. And CDC does this, and then we got blood from all of them, and they'll be looking at that also.
Blood from the mice, you mean, or?
Yes.
I see.
Yes.
Yeah, CDC does 2 different tests. They have a PCR where they can grind the fleas up and do PCR, and they also traditionally what they do is they grind them up and they inject them into healthy mice. And if the mice get sick, they euthanize them and test their spleen, culture their liver and spleen for Yersinia.
I see. Thank you.
Yeah. So the question on your mind is, yeah, there's 20 fewer mice and 1 fewer rat in the world. So.
What would people recommend for flea control right now? Like for flea and tick control, what's like for indoor, outdoor dogs like that? What's the thing that works best?
And that I'm turning over to the practitioners, to all of you guys.
Yeah, I mean, it's the usual stuff. I mean, the problem with the usual stuff is that, you know, the dogs can be out running around, and if they, you know, sniff a dead rodent in a burrow, they'll go up and sniff it, and the fleas are, you know, hungry, and they'll jump on the dog, and even if it's, you know, protected, has flea control, you know, the fleas don't die right away. And so if people allow these dogs to sleep in bed with them before these fleas get sick and die, they can get onto the people and bite them. So that's why the really major issue is don't let your dog sleep in bed with you.
Someone put in the chat that they had good results with, I'm going to butcher this pronunciation, Alaxalinors.
I don't know anything about that.
ALAXALANORS.
Oh, those
I
are like
don't know anything about that. I
Nectar,
know that.
Simparica trio, Pervecto, Credelio. Those are all the Alaxalinors, the new class of orals.
I mean, as usual, the question is whether or not these things keep the fleas from biting people and how quickly they do that.
Fair. That I don't know.
Yeah.
But as far as not
Yeah.
seeing live anymore, those seem to be good sets of newer drugs.
Yeah. I mean, these companies, you know, they don't do those tests, so nobody really knows.
I'm sorry, did Tim say where the person was, where they lived that had the plague?
I did. They're east side of the mountains,
Ah,
so towards that Edgewood area.
okay. Central New Mexico, in other words.
Yeah, I mean, you know, you take that part of Bernalillo County, Torrance County, Santa Fe, and Rio Arriba, and I think that's our plagued, you know, area. Most tularemias. So.
Yeah, that's one of our hot spots year after year.
Yeah, to go back to the flea control, does anyone run into any resistance in fleas to some of the common products?
My understanding is there's some question about certainly ticks and seeing frontline and even Advantix not as successful. From the perspective of fleas, I think that's anecdotal, but certainly the companies are really trying to tell us that we're seeing it more so that sell the oral products, for example, as to why to use those instead.
Do you see very many ticks? I mean, is ticks, I mean, in certain areas maybe, but across the state?
Yeah, I mean, there are hot spots. I mean, where there'll be lots of ticks in certain areas. So I think it's hit and miss. I think everybody on the calls probably has their clients, you know, from certain places that do come in with lots of ticks. And then if anybody hunts, or, you know, I can tell and John can elaborate on this, the wildlife that came into VDS, John and Norbert and Pete who are on there. I mean, there's oftentimes the deer are covered with ticks. So.
Any more questions or comments? If not, I think we'll move on.
John, can I ask a quick question from Tim?
Sure.
What is the meaning of these positive titers in the dogs? Do a lot of dogs get exposed to this type of tick?
Yeah, so it's a
Two,
great question.
one each hand.
We get asked that question a lot, and so yeah, the titers, a single titer in this particular situation. I mean, when you get them back from SLD or from
What else does
BDS,
he do with them?
it'll say any 1 to 16 or greater, considered positive, or tularemia 1 to 128, and that just kind of gets your attention, right? But with a single titer, all you can say is there's been exposure. So we know, for instance, the dogs we just talked about today, that they've been exposed. Are they actually infected, or do they have an actual infection going on? Couldn't tell you off of that single titer. But as a practitioner, you take that titer and you tie it to clinical signs, and you say, wow, this is highly suspect. The reality is you probably would have already started treating, because the animal would have had a fever or would have been lethargic, and you'd have taken a good history, and they'd have said, okay, we're from Edgewood area, or from up in Santa Fe, or Sandoval County, or somewhere, and say, okay, you'd already started them on proper antibiotic therapy. But with that single titer, all we can say is that there's exposure. It's the second titer, or the second sample, 3 weeks down the road, where we're looking for a 3 to 4 fold change, and that could be an increase or a decrease. And if we see that change, then we retroactively say, yeah, this is an active case. That's what's going on. So titers are just a part of the puzzle. A single titer is just a part of the puzzle. So we say, yep, there's been an antibody response. The animal has created antibodies, but that could have been just from an exposure, fought off the disease, the infection, and is doing just fine right now. So, make sense?
Would dogs be treated with doxycycline? Is that the usual treatment for dogs?
Doxycycline or one of the quinolones. Assuming that everything else is okay. Yeah. But I think most people would start on doxycycline. Jump in, Paul, wherever you want.
Yeah, no, that's fine. I mean, you have to understand you're dealing with a hyper-endemic area. There's no other place in the world like this. And so you can have dogs that have multiple exposures, and dogs are fairly becoming symptomatic with plague. So you can have dogs with fairly high titers who are just fine and don't need any treatment. So like Tim said, you want to have the 4-fold increase between the acute and convalescent sera, but again, that's tough, because by the time you get the convalescent, they're either better or they're not. So like Tim said, base it on, if they have a fever and they have clinical symptoms, they're sick and they're from one of these hyper-endemic areas, then, treat them for plague.
Is there a canine IgM for plague, or like for acute?
No.
No, not that I know of.
I mean, we're lucky that dogs rarely get sick enough to be able to transmit it to humans, as opposed to cats, who get extremely sick, are very susceptible, and can easily transmit to people and have killed people when they get pneumonic plague and cough in somebody's face. So take cats much more seriously, mask up, put your N95 mask on, and treat, and ask people if you can keep the animal in your clinic for 3 or 4 days while you treat them when you send them home.
And make sure whoever's treating is using the proper PPE, if you do that. But again, I think the thing that even when before Paul retired, and we had this discussion, is that the epidemiology is huge. We haven't seen this in most places of the state. So if you're down in Carlsbad and you have a fever of unknown origin, go ahead and treat. But the odds of the dog, you know, the animal hasn't traveled, the odds of it being plague are pretty low. But like I say, if it's in the Bernalillo, you know, the Edgewood area, the Torrance County, Santa Fe, you know, Placitas, and then go up a little north of that. That's
Rio Rancho,
Yeah.
Rio Rancho, Western Bernalillo County. Yeah.
Yeah, that Sandoval County area. Yep.
Yeah.
So,
Yeah.
so
Yeah, and someone commented in the chat that sporadic plague titers have been noted in wild Mexican wolves and coyotes. None have recorded being sick from it, and suspected of being exposed from wild rodents.
Yeah, they have titers. We I don't know if we've ever had a confirmed coyote or wolf that died from plague that we were able to culture and say, yes, that was the cause of death. Again, they're fairly resistant. Canines are.
yeah, we did have the mountain lion. It was positive.
Yeah. Again, cats, you know. Cats are much more susceptible.
If you identify a positive cat, then you would refer the owners to like Department of Health, and then they would determine maybe if the people needed post-exposure, maybe prophylaxis or something like that.
I would be on the phone. I would be on the phone immediately, 24/7 to Dr. Hannes, whether it's 3 a.m. in the morning or whatever. Call him up.
and I call forward to Dr. Edistat. But yeah, they can call the DOH, but DOH would not say, you know, to start. DOH would say, yes, you know, you need to get in touch with your primary care physician. You need to go to emergency room. You know, you need to do anything along those lines. But if a human isn't showing clinical signs, most people aren't going to. Some people may prophylax and treat, but they're going to go on fever watch, right? I mean, you start telling them you take your temperature twice a day for the next 7 days, and then. Go ahead, Paul.
That's a big part of Tim's job now, is that he's going to try to coordinate between the owner and the animal and the veterinarian and their primary care physician to try to figure out what the best thing to do for the people in the family that owns the animal. That's what he gets paid the big bucks for now.
Real big bucks.
Yeah.
You better move on, John.
Yeah, I was gonna say, we gotta probably beat that dead horse to death. Actually, Arlene, do you want to give your presentation now?
Sure, I'll go ahead and share my screen.
Yeah, go ahead.
Can you see it okay?
Yes.
Okay. And then to move the slides forward, do you with Zoom, is there you just enter?
Yeah, it's just your regular PowerPoint
Okay.
moving forward, however you prefer doing that.
Okay. Okay, well, thanks for the opportunity to give an overview, kind of a review of African swine fever, and then the recent detection in the Dominican Republic. So I just wanted to give a little bit of information on that. So these slides are adapted from a presentation by Dr. Antonoli from the Veterinary Services Swine staff, and also had contributions from a number of individuals, and also from the pig site, and a lot of it's the Center for Food Safety and Public Health at Iowa State. They have a lot of good resources. for slides and things like that. If you need to give a presentation or outreach materials, they have a lot of good materials there. So African swine fever virus, it's in the family Aspergillosis, and it's the only virus in that family in the genus Aspervirus. It's a large envelope DNA virus, and it's the only arbo DNA virus. The P72 capsid protein is one of the major proteins, then one of the main antigens that are detected in positive animals. And there's many genotypes in it, and there's no effective vaccine for African swine fever. So that's one of the biggest risks with African swine fever. They haven't been able to successfully make a vaccine. It's a complex virus with multiple genotypes and has variations in virulence from very high virulence, where you'd see up to 100% mortality, to low or moderate virulence, with some pigs developing persistent infection. So it can be hard to detect it. It can look like PRRS or erysipelas, or it can look like classical swine fever. So it can be hard to detect if it's a low or moderate virulence strain. And the genotypes 1 and 2 have been found outside of Africa. It's a resistant virus in the environment, especially at low temperatures. It can survive in feces for several days and for months in contaminated pens and in blood, and over 140 days in some pork products, so like salted dried hams or salami. So that's one of the big risks for people bringing pork products from countries that are affected with African swine fever. The Customs and Border Protection, they have a lot of controls in place. There's a lot of import restrictions, but people sometimes mail them or bring them in their luggage, and then the virus can live for a long time in frozen carcasses. So the species affected, only Suidae are affected. So it's not a foodborne disease for people or other animals. Domestic pigs, feral domestic swine, and wild pigs can be infected with the virus. The Eurasian wild boars have become infected in Russia and some parts of Europe, and they can get sick and die from the virus. And so unfortunately, it's a kind of a reservoir in certain parts of Europe and Russia where they have these wild native boars infected. The reservoir hosts are wild pigs in Africa. So warthogs, bush pigs, and giant forest hogs are the reservoir hosts, and it doesn't make these animals sick. They adapted to the virus over probably millions of years, and there's a wildlife cycle between the wild pigs and soft ticks in the environment. So it cycles there, but it can spill over into domestic pigs and then cause disease. So the virus, it enters pigs via oral or nasal route after a tick bite. It replicates in the tonsils or the regional lymph nodes, and then spreads through the lymph or blood to secondary organs. And this virus, it replicates in macrophages, monocytes, endothelial cells, renal tubular cells, and also neutrophils. So it causes a severe leukopenia. And so part of its pathogenesis is to cause a general state of immunodeficiency, and then animals will get secondary infections. And so some of the clinical signs are hemorrhages, and on necropsy, splenomegaly, pulmonary edema, disseminated intravascular coagulopathy, and the virus can replicate inside the soft ticks. So clinically, can see it looks like lots of other swine diseases: fever, anorexia, listlessness, huddling and piling, trembling, vomiting and diarrhea, sometimes bloody diarrhea, conjunctivitis. Pigs can be anorexic and not eating, reddening of the skin, tips of the ears, tail, extremities, and ventral parts of the chest and abdomen, and they can become cyanotic, and they can develop neurological signs, incarnation and paddling, about 24 to 48 hours before death. And death can take a long time. These pigs can be infected for up to 20 days. So it can be a slowly progressive disease that's hard to identify rapidly. Pigs can also have abortions, and some of the survivors of the low and moderate virulent strains can be virus carriers. So these are some pictures of of infected pigs, splenomegaly and depressed pigs that are huddling together, pigs that are have cyanosis and hemorrhage on bloody diarrhea and enlarged hemorrhagic lymph nodes. And it's transmitted between pigs by direct contact, so oral, nasal, or all the secretions from infected pigs, blood, tissues contain the virus and can be infectious. And then the virus can contaminate the environment. So transportation, trucks, and equipment is shared between farms or to move pigs, or shoes, or so fomites are a big risk factor. And then ingestion of contaminated feed products. So around the world, and in the US too, in some states there's food waste is fed to pigs. And also, so that's one of the ways that in like the Republic of Georgia and some other places around the world, they think that it was introduced. And in the UK, they think that's how foot and mouth was brought into the UK in 2001. And feed products that are imported into the US that are used to make swine food rations, like some supplements and vitamins and minerals. Some of them are brought from countries that have ASF, like China or others. So that's been a concern, and there's been a lot of work studying that and trying to mitigate the risks of bringing in either on the packaging of those materials or in the materials themselves, maybe bringing in the virus that way. Also, infected carcasses can the virus can survive in them for a long period of time. So if there's feral pigs or wild pigs that have died from the virus, then they can be a fomite for other pigs getting exposed. In the wild, the vector is a soft tick, the Ornithodoros ticks. And I think there's been some research to see if the soft ticks in the US could transmit ASF. Other insects might be able to mechanically spread the virus, like mosquitoes or biting flies. And there's just all sorts of risk factors for spread. There's landfills in some of the countries, like different forages or dried grains or drieds, they could be exposed to infected pigs, and transportation. And then coming into the US and other countries, different pork products. So they have increased the Customs Border Protection. They've always got controls in place, from countries that have the disease, and now they've increased it more for flights coming in from Dominican Republic. They've increased it, and so they're doing extra monitoring and outreach to those passengers, and they have the beagles out there at the airports checking baggage and the mail too, to monitor the mail. So there's a study done in Russia to study some of the risk factors for farms that became infected. And some of the risk factors were contaminated vehicles, feeding contaminated feeds, direct contact between farms, and contact with wild pigs. And for long distance spread, movement of live infected pigs. So pigs might have a less virulent form, or people might want to move them before, if they don't get reimbursed for depopulation, they might want to move them before they die, things like that. So they can be moved long distances in live pigs. So geographically, the virus was discovered in Kenya in 1921, and today it's endemic in wild pigs in sub-Saharan Africa, and it doesn't cause disease in those, but it can spill over into domestic pigs in Africa and cause disease. And then the first occurrence outside of Africa was in Portugal in 1957, and it spread to Spain, and then it spread to Europe. And they were able to eradicate it, but it took quite a while to eradicate it. And it's still considered endemic, I think, in wild pigs on the island of Sardinia. So in places where there's wild pigs, like wild boar, then it might stay endemic. You might not be able to eradicate it. in those areas. So in 1963, they were able to determine that the soft tick was one of the vectors of the disease, the Ornithodorus erraticus in Africa. And then in 1971 was the first time that it was identified in the Western Hemisphere, and it was outbreak in Cuba, Dominican Republic, Haiti, and Brazil, and they were able to eradicate it. It took several years, and then the recent spread and the more widespread, the Republic of Georgia in 2007. They think it came from South Africa in some food waste that was fed to pigs in the Republic of Georgia, and from there it spread into Eurasia and the Russian Federation. So it's been in Russia for a number of years, and then spread from Russia into Eastern Europe, Lithuania, Latvia, Poland, Romania, and I guess wild boar in Iran, and then wild boar in some of these countries, and then it has spilled over some into domestic pigs. And then the biggest and probably one of the highest risk for the U.S. was spread to China. And so that was a huge outbreak that's still going on in China. And China has the largest domestic pig population in the whole world. So they've had large die-offs of pigs and still working to control it in China. And then from China, it spread to many countries in Asia. And then it's been spreading gradually towards Western Europe. So today, from 2020 to April of this year, the more recent cases, Germany has had cases, so that's in more into Western Europe, India, Malaysia, and Papua New Guinea. So it's widespread in Asia and parts of Europe. So in the Americas, so Cuba was the first in 1971, and they were able to control it with local depopulation. 1978 to 1980, they had the disease in Dominican Republic and Haiti. So that's the last time that it was detected there. And they had to do total eradication of pigs in many of the areas to control the disease. And then in 1978 to 81, they eradicated with targeted eradication. So it's been about 40 years since it's been detected in the Dominican Republic. So it's gotten to the Americas 4 times, in the past 40 years. So it's definitely a bigger risk closer to the U.S. And so the ASF was detected on July 28th in the Dominican Republic, and the samples were run at the Foreign Animal Disease Lab on Plum Island. And classical swine fever has been endemic in the Dominican Republic and Haiti for quite a few years, I think. And there's been a program with USDA and the Foreign Animal Disease Diagnostic Lab to help support some classical swine fever surveillance for Dominican Republic. So they were already sending some samples to FATL, and they had some clinical signs of mortality in some farms, and they sent samples for ASF, and they did identify the virus in two backyard farms in 2 different provinces in Dominican Republic, and they sequenced the virus, and it's that Georgia strain from the Republic of Georgia in 2007, and that's a really widespread strain that's spreading to many parts of the world. And so since July 28th, it's spread to about 14 of the 31 provinces in the Dominican Republic. And so the response there, they have, so USDA has helped with diagnostic lab support. So they send equipment, and they've been helping with experts in running the different assays. So now Dominican Republic is able to run samples on their own, and they're sending some samples still to FATL, I think. But so they're quarantining, culling positive animals and their contacts, and they are able to compensate farmers for the culled animals. They have movement controls, surveillance testing, and also enhanced biosecurity and disinfection. And so they're getting some assistance from different countries in Europe. So Spain and Portugal had ASF, and it took them many years to control it. So there, some experts from Spain have gone to Dominican Republic to help, and then they have some support from FAO and other agencies that are giving them support. And then USDA would provide more support if it was requested from Dominican Republic. So this is a picture from the OIE website. It shows the two provinces where they detected the first 2 cases. So they were pretty far apart. So it's likely that there was fairly widespread disease by the time it was detected at the end of July. And Haiti, so Dominican Republic is next to Haiti on the island of Hispaniola. And so Haiti, I feel so sad for Haiti. They had the president assassinated, and then they had that terrible earthquake. So they haven't been able to, they've just been doing humanitarian crisis, and they haven't been able to do, a lot of animal disease work. So it's possible that it's in Haiti too, but there hasn't been any confirmed cases. And you can see how close Puerto Rico and the British Virgin Islands are to Dominican Republic. So Puerto Rico, they've had a long-standing classical swine fever surveillance program. And so they increased that for African swine fever. There's illegal boat landings from Dominican Republic. Puerto Rico has a lot of small backyard farms and garbage-fed pigs. And after the hurricanes in Puerto Rico, they had a lot of domestic pigs that escaped. So they have quite a few feral pigs. So there's a lot of feral swine control work going on. The Wildlife Services from USDA has been working with the Puerto Rico to help contain the feral swine. So there's a lot of outreach and things going on in Puerto Rico to try to detect it if it does get there and contain it rapidly. So for diagnostic testing, for virus detection, tonsil, spleen, lymph node, and blood are the tissues that would be submitted. Virus isolation takes up to 21 days in swine macrophages, and PCR can be run fairly rapidly in a few hours. And FATL, they're the confirmatory labs, and there's a number of National Animal Health Laboratory Network labs like NMVDS that can run the PCR for African swine fever and classical swine fever. And so those, so if you have a suspect for an animal disease investigation, samples can go to the non-lab. And I don't think NMVDS has the ASF and CSF. There's mostly their labs that have that large swine populations in the state.
Hey, Arlene, I'm going to interrupt. Yeah,
Yeah.
it's just, I know I'm not there anymore, but yeah, they're proficient and VDS can do it.
Oh, you can do it? Okay, so you can do ASF and CSF?
Yes.
Yep.
Okay, cool. Okay, well, that's good to know. So, okay, sorry about that. So, so that's really good because those tests can be run rapidly, and you can, you have to wait for confirmation at the FATL lab, but you can get a really fast result because it takes, a day to get to Plum Island from New Mexico, and so you get delays. Sometimes they have storms, so it's good if you can run them locally, and from 2 separate sets of samples. So there's also antigen detection in tissues, immunostaining that can be run at FATL. And then serology tests, ELISA and immunoperoxidase testing. And in the US, depending on the state, the Swine Health Protection Act is a federal law for garbage feeding, so requiring licensing of garbage feeders and inspections and temperature checks. So there's it's one of the risk factors for ASF, so there's been more scrutiny of it. 27 states plus Puerto Rico and the US Virgin Islands allow garbage feeding, and New Mexico is one of the states that does allow it. And currently there's 2 active licensed garbage feeders, so it's gradually been dwindling over time. And 33 states prohibit garbage feeding, but they're encouraging searches within states for garbage feeders for new ones or illegal ones, that there's a lot of food waste from restaurants or schools or casinos, places like that, that have a lot of food waste that sometimes, people will pick up for feeding pigs. And so they can become licensed and inspected and legally, they have to cook it for a minimum of 30 minutes. So they have to have the capacity to do that for all the food that's fed to the pigs. And so hopefully, we can prevent it from coming in, and then hopefully rapidly detect it if it did enter somehow. There's some new research on ropes that are put in like pins of pigs, and they're curious and they chew on the ropes and they use them for different disease surveillance. So they're looking at that for ASF. And so for reporting clinical signs in pigs in New Mexico, Dr. Zimmerman, the state veterinarian, is the contact. Also, Dr. Shobalio at USDA. And there's a lot of good resources, OIE website, also the USDA website, and then Center for Food Safety and Public Health has a lot of good reference materials. And then there's my contact information. And I just wanted to thank Dr. Antonelli again, that I kind of adapted her presentation for this talk. So thanks for the opportunity.
Any questions or comments about African swine fever? Other than
Arlene, this
never
is
see it.
Paul. Arlene, this is Paul.
Hello.
I can remember when I was with USDA, I had a new guys who told me about when they worked in the Dominican Republic and Haiti when in the last outbreak in the late 70s and early 80s, and one of the issues then was they were trying to eradicate the disease by going to people's herds that tested positive and just depopulating everything. And what everyone, all the natives were talking about was that USDA was replacing their black pigs, which tasted much better, with these USDA white pigs that didn't taste as good, and so people were hiding their pigs because they didn't want to get rid of the good tasting pigs that they had. Was there any issue with that with this outbreak?
I'm not sure. I guess there's I know some of the Foreign Service people that with USDA are there in Dominican Republic, but we haven't had, I guess, a lot of people on the ground there at this time. They're communicating with them, but I know that they in some of the news releases I saw from Dominican Republic, they made a point of saying, we're compensating people for their pigs. They have, I guess they have, when they go out to depopulate pigs, they have, someone from the bank, I guess, to collect the information for indemnity and stuff. So I think they're trying to head that off, but I know, like in places like England, when they depopulated all those old breeds and things like that, that was a huge impact, because there weren't that many of some of those rare breeds, that were kind of heritage breeds. And so I'm sure that those things are, an issue. And people, I know in like China, if they weren't paying a good, if they weren't reimbursing people were moving those pigs around and stuff like that. So that's really important to make sure that, that people know they're going to get reimbursed if their pigs are depopulated. But I'm sure those heritage breeds stuff, that could be an issue, and just getting around and, in those areas, with Haiti and stuff, it's really hard to, I know one of the concerns is the search and rescue dogs that are going over there, and coming back, they're doing decontamination, making sure that those dogs and all their bedding and equipment isn't contaminated when they're coming back.
Yeah. I know that USDA is working on a vaccine. Do you have any updates on their vaccine?
I've heard that it's close, but that, I guess, you know, that's, people have been working on it for so long. It's really, I guess, I don't completely understand, but I guess it, you know, it's a really complicated virus, and a lot of the way it acts is it affects immune cells, and it affects the immunity. So it's just been really hard to make a vaccine that doesn't, you know, I guess, decrease their immunity, or, you know, they just haven't. But I heard recently that they're close. So hopefully, you know, with all the different, you know, vaccine technology and things like that, they can get some vaccines that, because that's the pretty much the holy grail. Like for classical swine fever, there is a vaccine, and it's a DIVA vaccine. So it can be, you can tell it apart from a wild type infection. So for classical swine fever, you know, there is a vaccine, although still it's widespread, but for African swine fever, there's no vaccine. So it's just, it can be hard. It can spread relatively slowly. You know, you think you'd just have like die-offs of pigs, but it can spread relatively slowly within a group of pigs. So you might not be real obvious initially that you've got it.
All right, thanks.
Okay, yeah, someone commented in the chat, thanks for the African swine fever talk. And I think we'll move on to keep things going. Pete, can you hear me?
Can people hear me?
Yes.
Okay. I can't hear you very well. Okay, let's see what we can do here. I am here to talk mostly about fatty livers. It's been a subject of interest over the last several weeks with all the new puppies in the area. So let's see what we can do here. And we have, is everybody okay hearing me now?
Yes.
Okay, great. I am still getting, we just installed Zoom on this computer today, so we're still getting used to it. Okay, there we go. Okay, welcome back. Well, first of all, something that has come up several times lately is this juvenile hepatic lipidosis in the little puppies, and this is puppy season. I think with the pandemic and everything else, people are leaning towards more indoor dogs, the small miniature and toy ones. It seems like we're seeing an uptick in cases of this. And again, this is puppy season, just like it's kitten season. So it may be, it's certainly not a statistical sampling. But let me go to the syndrome and its definition. It's a condition of anorexic, cachectic, sick, otherwise stressed puppies. And there's an unlimited number of stressors, and we learned that in pathology, of course. And the condition is basically a pathological distribution of normal physiologic events in these young puppies, but pathological distribution and of normal physiological events, that's basically your definition for disease. So that's pretty, you know, I thought that was pretty dumb when I went and reviewed it today, but is it going? Uh-oh. Just clicked on that one too. Oh, okay, and then I go with the arrows. Oh, okay. And we'll just go with the arrows here then. All right. Now we're back. And everyone can hear me now. Is that correct? Oh, no. Okay.
Yes, we can hear you.
Oh, excellent. Okay. Good. So I want to talk about one, and I'm not going to mention any of the ones that we've had lately, so that we don't, so that we protect the innocent or the guilty or whatever. But this is the case I had about a year ago in a little 10-week-old miniature dachshund, and I emphasize these stressors that we're looking at here to these puppies delivered to a new home after a few 100-mile trip from the breeder. The breeder sent the dog from Central Texas to New Mexico. This dog has been on at the breeder, a reputable puppy ration, but was changed to another emphasized reputable puppy ration when it arrived at its new home, and it promptly quit eating. The other stressor here is that it was recently booster vaccinated with your typical booster vaccines, your typical canine vaccines. This is here we go. Let's try this. This again, 10-week-old female is only nibbling at his new feed, her new feed, which, as I said, was also a reputable puppy ration. And then this anorexia was accompanied by minimal water intake, and there was some dehydration involved. And typical of this type of condition, there was a period of increased somnolence, and then the animal died, semi-comatose first. Blood glucose, I want to emphasize, was at less than 60 milligrams per milliliter. And the other emphasis I wanted to make on this was that blood glucose levels at the start of this condition are usually quite elevated, sometimes 300 or 350 milligrams per milliliter. I believe it's the body's attempt to try and squeeze out a little bit more glucose from the glycogen that's stored in muscle. However, in these small dogs, there really isn't very much glycogen that they can call on in a period of stress. So that muscle glycogen is exhausted in a hurry. And this case management went along like this. They had it recognized, the glucose being that low, fluids were aggressively administered, and then heat was applied to this patient because it was hypothermic. But typical of these patients, it is a fairly poor prognosis. This patient died within 24 hours after they started treatment at the presenting clinic. Necropsy was recommended to the owner, and it arrived here. It was in a fairly good body condition, typical 3 of 9, typical of growing puppies. These animals become fairly thin quickly, so I felt that this animal was in pretty good shape for the stress it had gone through for the last several days. Typical, the anorexia was reflected by the GI tract, which was empty. The liver and kidney were light tan. And let's go to some necropsy photos here to give you an idea. Notice that this white organ in the center of the picture here is the puppy's liver. I do not think that this is the same puppy, but this is one that Dr. Ragsdale hauled out for me, I believe. Definitely it is. One thing, if you're doing this necropsy, one of the stellar points is that the liver floats in the formalin container, and normal livers don't float. Indeed, normal canine liver contains about 2% fat content, and these lipidotic toy breed puppies can contain, I think I've read somewhere 36 to up to 50% fat. So that's pretty remarkable. And this is the liver removed in toto. This was again Dr. Ragsdale that shared these pictures with me. He is an Oscar candidate for his photography, and I appreciate it because I'm not. But One of those things that I've done a lot of is histopathology on these creatures. This is one that I probably took about 10 years ago or more, but this is the typical acute microvesicular or microvacuolar hepatopathy of acute, I emphasize that, hepatic lipidosis. The vesicles, you can see them here, are small and clearly demarcated. We'll show that in a little bit higher mag here in a second. And they won't cause peripheralization of the hepatocyte nuclei. Notice that they're all right in the center of hepatocytes. They're round normally, as they should be. And the lipid droplets have not coalesced to cause the great big macro-vacuolar change that will cause the peripheralization of these nuclei. That's more of a chronic change, and you won't see these puppies surviving beyond this acute phase. Not typical of hepatic lipidosis in some species, but certainly this is early stage hepatic microvacuolar hepatopathy. With the macrovacuolar, and I'll show a couple pictures of that in a second if I can, you'll see that there are one or two large vesicles that will cause peripheralization of the nucleus into a crescentic shape. Go down another one. This is a higher magnification. This is probably not the same liver as on the last slide. You can see that the vacuoles are somewhat larger, more definitive. You can see them under the high mag here. They're clearly defined as opposed to glycogen vacuoles, which are usually glycogen granules rather than vacuoles. Typically of the microvacuolar hepatopathy, again, we have the central round nuclei that haven't been compressed yet. And the mechanisms, protein deficiency causes a methionine deficiency. And this is accompanied by anorexia that causes choline deficiency. And they're both needed for the production of cell membrane. When these cell membranes in the growing puppy are needed and we fall short, then the fat builds up in the liver, and there are carrier proteins that cannot function within the membranes to get that fat out of the liver and to liberate glycogen because there is no glycogen left. Small breeding puppies have, as I mentioned, a small skeletal muscle volume, and in addition, they have an increased basal metabolic rate. You can get fatty liver in Great Dane puppies, particularly if they're sick, and other dogs as well, but the small breeding puppies, toys and miniatures are classic. As glucose is liberated from the muscle, skeletal muscle again, stores of glycogen, because there isn't much there to begin with, are rapidly depleted due to this high basal metabolic rate. Large neurons in the brain can also die. Let me back up just a moment here. The loss of here we go. When it's liberated from the glycogen in the skeletal muscle, the high basal metabolic rate is the cause for this loss of glycogen. And the other thing that probably is most important is small meals of high protein to these dogs, even hourly if you can get it down. Can't emphasize this enough because of the loss of the skeletal muscle and the liver stores of glycogen. And let's go on. In the late stages, large neurons can die, especially the large neurons. They require more glucose. If the hypoglycemia is sustained, they die because they are the most sensitive, because they're the largest of the neurons, to the lack of glucose in the plasma. Loss of neurons probably contributes to this somnolence during the middle and late stages of the hypoglycemia. Contributes, I don't say it does all of it. And here's another photomicrograph that Dr. Ragsdale, courtesy of Dr. Ragsdale, thank you, John, from the cerebellum in a puppy. This is necropsy that he performed within the last few days himself. These are two of the Purkinje cells. The upper one here is, you might say it's in the degenerate stage. It's on its way out. Notice that it's shrunken, has kind of scalloped borders. It's, I would say, hypereosinophilic. not like this one, which is even more hypereosinophilic, but notice the slightly condensed compressed nucleus in this one, and this one here is pycnotic, and the stage, the cell itself is in a stage of accelerated senescence with the shrinkage of the cytoplasm. I believe that's it. Can people hear me? And are there any questions?
I had a question.
Yes.
You on the causes, you were saying protein deficiency causes deficiency of methionine, and then what was the second thing that you said? I didn't quite catch
Choline.
that. Choline. Okay.
Phosphatidylcholine, one of the membrane's basic ingredients, is lacking when you don't have enough choline there. CHOLINE.
Okay. And then how does that contribute to the low glucose and the puppy being sick?
Well, you have to have the glucose. You have to have the glucose available for the energy that's required for ATP to move these chemicals around.
Ah, okay.
And glucose is kind of like, oxidative glucose provides, I don't remember my Krebs cycle very well, but I think it's like 36 moles of ATP for this reaction. And as a result of that depleting in a hurry, this is where you end up with the type of hypoglycemia that you end up with because of the lack of protein, basically. But energy is also required in these high energy, high protein diets.
Thank you.
Other
Are
questions?
there any breeds that are more susceptible, or like genetic lines that are more susceptible to this disease?
Yes, my answer is yes. Yorkshire Terriers, toy Yorkies and things like that appear to be more susceptible. There are a couple of other breeds. Right now, I can't recall them, but there are a couple of other toy breeds that seem to be more susceptible. I found that on the web while I was putting this together, and if anybody knows me, they know me in dog breeds. I just don't know, but Yorkies are pretty well represented here. The miniature dachshund was kind of like off the chart, but it is seen. At least I've seen N equals 1. The one that I had, two that I've had in the last few days were, at least one of them was a Shih Tzu, and another one was may have been a Lhasa Apso cross. I'm not certain. Again, toy miniature breeds, and highly stressed. Recently shipped in both cases, and shipped from breeders a long way off.
Yeah, Dr. Sandlin has her hand raised. You have a question?
Is there another question?
I thought so. Somebody had their hand raised icon on, but oh, there we go.
Yes.
Can you hear me?
Yes, I can.
Oh, is this the same as the fading puppy syndrome that I've heard of? Or is it different? Because
well,
of the
actually,
hypoglycemia, etc.
I'd have to say yes and no. Fading puppy syndrome is, as you can imagine, is a pretty generic name. In fading puppy syndrome, the way I've understood it is that when somebody says, this puppy has fading puppy syndrome, I'm thinking of sepsis due to strep canis. And I'm also thinking of canine herpes virus. These little ones that are sucking, and then they just, travel away from the nest, or they become hypothermic. And I would have to say that, this type of symptomology would definitely be a fading puppy syndrome, but those are the two. And I imagine there's other vets out there that could also lump together fading puppy syndrome with a couple of other diseases. But herpes and strep canis are the two that, that I've classically heard it mentioned.
Okay, thank you.
Yes. Generic term. I hate them, but we've got
That's
them.
kind of what I thought, but I just didn't have an exact recollection of what was the fading puppy syndrome.
Yes. Well, here's an anecdote for you. Go out to the farm with the horses where the horses all have distemper and try and explain how it's not the same thing as their dogs and their cats get. I've been there and done that, but anyhow. Yes, other questions?
I know in cats, like hepatic lipidosis is a big thing in anorexic cats. Do you guys see that fairly often too?
Yes, we do. And the cats, I would have to say more often in obese cats that can't handle periods of anorexia. But cats that have prolonged illness, much less so, but we do see it, especially those that are, have multiple stressors. Let's put it that way. But obese cats is, you've got to handle them with tenterhooks when you're dealing with one that goes sick.
Sometimes they're diabetic as well. Yeah.
Exactly. Yes. Yeah. I've got two other short ones on lipidosis, hepatic lipidosis. If anybody, wants to go ahead of me, please do. John, you're the mediator, but let me bug out if somebody else, other cases to go through.
Yeah, I'll go ahead and start a couple of mine. We don't have much time left, and let's okay, is that coming up for everybody?
Yes.
Okay. Yeah, the first one I'm going to discuss is a mortality event that happened in elk a couple years ago. It was in the December of 2019 and January of 2020. There were at least 25 female elk cows that were found dead in the Tularosa Basin near Bend, New Mexico. Of those 25, we received 2 carcasses for necropsy and then tissues and from another necropsy that was performed in the field. So unfortunately, there were no gross or microscopic lesions in any of those 3. But we did find large fragments of these leaves in the rumen content. And those leaves were identified as oleander. And if you remember toxicology, oleander is a pretty toxic plant. It's an evergreen shrub in the dogbane family. It contains multiple cardiac glycosides, but the main one and the one that's been most studied is one called oleandrin. All parts of the plant are toxic: leaves, flowers, even the woody parts. There have been even cases of people being intoxicated when using oleander sticks to roast marshmallows or hot dogs on campfires. How the cardiac glycosides work, or they inhibit the sodium and potassium pump in the cardiac myofibers in particular. The increased intracellular sodium causes the pump that gets rid of the intracellular calcium to stop working. So there's increased intracellular calcium. So at therapeutic levels, this leads to increased contractility of the myocardium, and so it helps the heart function better. But at toxic levels, this often causes arrhythmias, tachycardia, bradycardia. Probably the most common arrhythmia that I've seen, it causes ventricular premature contractions, and it's often fatal. One thing is that oleander is bitter, so a lot of herbivores won't eat the plants. But if you're an elk in New Mexico in the middle of winter, in a year with severe to extreme drought, you're probably going to eat anything green that you can find. So the question was, how did the elk get this oleander? So after the diagnosis was made, the game and fish people went door to door in that neighborhood and actually found somebody that had cut the oleander shrubs from his property and disposed of them out in the back 40. And the elk started eating them and died. So the game and fish people collected all the remaining oleander plants out there and then disposed of them properly. And then the elk mortalities ceased. So, and that's all I have on that one. Are there any questions or comments or? If not, we'll move on to a rabbit that was hemorrhaging. It was a 2-year-old, 7 pounds, intact female domestic rabbit, had an acute onset of lethargy and anorexia, and the owner noticed blood from the rectum. On physical exam, it was hypothermic. The mucous membranes were pale. The stomach was firm. It died within 1 hour of presentation. And after death, it passed normal stool, but then blood was noticed from the rectum. And because of recent history, rabbit hemorrhagic disease was suspected. There was bleeding from orifices is one of the clinical signs of rabbit hemorrhagic disease. But on postmortem exam, this was found in the uterus. These rather large, we'll go back, red dilations of the uterus. So rabbits are kind of strange as far as their uterus goes. The cervix is actually here, so the rest of this is vagina. Kind of this dark coloration is blood in the vagina, and there's blood in this uterine horn. And here the uterine horns opened up, and you see those those red areas correspond to these red areas. And microscopically, here's the normal endometrium on the left. And here are those red areas on the right. So these are actually dilated veins that are filled with blood, and this one actually is filled with a blood clot. So these are venous aneurysms in the endometrium. And as far as I know, this only occurs in rabbits. It's usually in non-pregnant rabbits. Some sources say the multiparous does. Some others say they're nulliparous or haven't had any young ones. It's most likely a congenital defect in the endometrium, in the veins of the endometrium, and coagulation disorders and trauma are not thought to play a role in development of the disease. So as far as clinical signs, you'll usually see urogenital bleeding. You can be mistaken for hematuria, or as in this case, blood from the rectum. These affected does are often anemic. The urinalysis, they will have hematuria and proteinuria. And if left untreated, they will, like this rabbit, just become anemic enough to die. And the differential diagnosis, as far as masses in the uterus, are uterine adenocarcinomas, endometrial hyperplasia or polyps, and pyometra and endometritis. I guess you'd have to throw pregnancy in there as well. As far as the bleeding, one big thing that we have to think of from recent history, like I said, is rabbit hemorrhagic disease. So are there any questions on that case or comments or? This is a pretty rare disorder that don't see very many of it at all. So.
I have a question.
Sure.
Could there have been a quick way to rule out rabbit hemorrhagic disease before the rabbit died in this bunny?
The only test I know for the rabbit hemorrhagic disease is postmortem PCR on the liver.
Only because, calling suspect cases certainly would be recommended. And, if there was any quicker way to figure it out before we recommended that would be nice.
So this is
But
Tim,
no.
and this is Tim, and if it was rabbit hemorrhagic disease, it wouldn't have lived very long at all. Typically within 24 hours of seeing clinical signs, they're dead. And I don't know if Ralph is still on, but he's seen more of it than I have. But it wouldn't live as long as this rabbit did.
Okay. Thank you.
Okay, if there's no more questions. Yeah, we'll talk about a kitten that was 15 weeks old, 2.5 pounds, castrated male, domestic short hair that died suddenly and was presented at as a DOA at emergency clinic. At postmortem, the lesions were in the kidney. I don't know if you can can see my cursor, but here in the medulla, there's this white area that is surrounded by this kind of tan and red area. And after fixation, it's a little more evident. It's a little more white versus the brown of the fixed tissue. Here is the histopath of that area. This is the normal medulla. This is the affected necrotic medulla. This is the area of necrosis. And just a higher power. This is the normal medulla where the tubules are still intact. And this is the necrotic medulla. So this little kitten actually died of acute renal failure caused by renal medullary necrosis. And that's, the more current term. It was formerly known as renal crest necrosis or renal papillary necrosis, depending on the species and their anatomical configuration of their kidney. It has several causes. In cats, it's most recognized when there's medullary amyloidosis that causes decreased blood flow to that medulla and causes infarction. There wasn't any medullary amyloidosis in this cat. We most commonly see it after non-steroidal anti-inflammatory drug administration, particularly when an animal is dehydrated. This is most commonly seen in dogs and horses, but we can see it in other animals. Also, urinary obstructions leading to hydronephrosis or pyelonephritis, or just renal hypovolemia and infarction can cause it, which there was no evidence of that in this kitten. So my theory was that this kitten somehow got into an NSAID and then caused the medullary necrosis. So we'll talk about a little bit about renal medullary necrosis due to the NSAIDs. Like I said before, it's most common in dogs and horses, but it can happen in multiple species, including people. People are a little more resistant to it than dogs and horses. As you all know, NSAIDs are COX inhibitors. COX is an enzyme that's important in the formation of prostaglandins. The renal blood flow is dependent on vasodilation by prostaglandin E2. So when the formation of prostaglandin E2 is not is inhibited, that area of the renal medulla doesn't get its proper blood flow, so it leads to ischemia. So how did this kitten end up with NSAID toxicity? I don't know this for sure, and I don't know the complete story about this kitten, but being a kitten, it's entirely possible that somebody dropped a Tylenol or ibuprofen or something on the floor, and the kitten decided it was a treat or something and ate it. But that is just a wild guess on my part. So any questions about that case at all, or comments? Or
Were both kidneys affected?
yes. Yes, both kidneys were affected. If only one kidney is affected, the other kidney can compensate, and they can actually do really fine. There's still enough renal capacity there to
Which
be a healthy
rotel
animal.
did you use, Sally?
What was that? All right, if there's not any more questions or comments, we'll move on to large animal. To just add a little flavor to the presentations. It was sudden death in a 10-month-old, 942-pound Charolais steer. There was reported a no change in the feed or hay. The steer didn't eat well the day before it died. The day it died, the appetite returned to normal. There were no signs of illness prior to this. He was found dead when they went out the next morning, and they had another steer that died a month prior with the similar circumstances. And rumen contents in cattle should be nice and grassy and have a lot of liquid instead of all this foam. And it should not have all this grain.
Beef chicken?
And there's this is the esophagus. Usually the left-hand side is really congested. This side is blanched because what happens? Well, actually, this was bloat. Because what happens when they bloat is that there's actually so much gas and liquid in the rumen that it compresses the thorax, and there's actually enough pressure that it prevents venous return from the head and neck. So everything cranial to the thoracic inlet's really congested.
It was very good.
And it's kind of similar in the trachea. And taking the rumen pH of this guy, the normal rumen pH should be on grass, should be about 6.5 to 7. Feedlot calves, when they're on full grain, could be as low as 5.5. This guy's rumen pH was between 4 and 5. So, like I said, it had rumen acidosis from grain overload, otherwise known as bloat. So what happens in these guys when they eat a lot of grain? Grain is full of highly digestible carbohydrates.
Excuse me, John. Excuse me. Can we ask everybody to please mute your phones or your computers? Thank you. Sorry, John, we couldn't hear you.
Okay. Where do you want me to go?
I think just pick up where you're at.
Okay.
We could see your slides.
What happens when these guys eat a lot of grain, specifically those grains with highly digestible carbohydrates like corn, barley, and wheat, is that the gram-positive bacteria in the rumen really like those carbohydrates, and they start producing lactic acid. The lactic acid, as the pH goes down, kills off a lot of the other good bacteria, such as lactobacillus, and kills off some of the fungi and protozoa that are in there that help maintain the good balance. With the decreased pH, there's an influx of water, and there's also a lot of gas production. So over time, acidemia and metabolic acidosis develop, and most of these calves die within 24 to 72 hours. So that is all I had. So are there any questions or comments? Like there's a few questions here in the chat asking about the elk, the heart, asking if the heart was normal. Yes, the heart was grossly and microscopically normal in those elk. With chronic cardiac glycoside toxicity, you can see some myocardial necrosis, but a lot of these animals don't live that long. Yeah, a lot of that is just the death is mainly due to the arrhythmias that it causes. The contractility changes are what you're hoping for with therapeutics. The question was whether the death is just the contractility. It's mainly the arrhythmias that develop that lead to the death. And another question was wondering what conditions NSAIDs have been reported to cause renal necrosis in horses. It's not really specific to a condition. It's just when NSAIDs are administered for whatever reason. It's just that, especially when horses and dogs are dehydrated, because there's not as much renal blood flow to that area. It's not really a specific condition. It's just more of the administration of the NSAIDs. And there's another question on an unrelated topic about the increase in the number of parvo cases. I would say it's been about pretty typical, not an increase or decrease. In years past, another question is, and if so, is this in vaccinated dogs? In years past, we've seen more in vaccinated dogs, but I can't remember seeing a parvo case come through necropsy in a vaccinated dog this year. And I don't see any more questions in the chat. And that's all I had. I don't know if Pete, if you can fill in another one.
Sure. Can you hear me?
Yep.
Excellent. Well, let me go to, let's see, we got 10 minutes. So let me show you another rabbit. Let's see if I can do this right. Nothing like having rabbits on the necropsy floor, huh? But, you know, the pocket pet business is picking up, and I think at the veterinary clinics, they're seeing a few more. So this is one that I had very recently, and this was, let's see, the syndrome of hepatic lipidosis in a rabbit.
Can you start your video, Pete?
Start my video. Oh my goodness. Let's see. Okay. Share the screen.
Yes.
Are we better now? Can we see that? Uh-oh. Oh no.
Yes, we can see that.
Okay. I think we're good, John.
Okay.
Going to the full screen is difficult on this one here. I mute myself when I do that. So I'm gonna just go with this and we'll put the message in the central screen here, and hopefully that'll get the message across. But again, we're seeing a lot of rabbits here, which is interesting. They have some interesting diseases. I will add to what John said earlier. If you don't breed your rabbits, then you won't see the condition that he was showing, but that Perhaps more breeding of rabbits will lead to fewer adenocarcinomas of the uterus, which is a pretty common thing in rabbits. The way I learned it, that's the most common tumor of the, or the most common finding in a reproductive tract of the rabbit. But I'm not a rabbit expert, but I'll be getting there with a few more of these cases. Anyhow, this is hepatic lipidosis in a pet rabbit. This is an adult female. The age wasn't specified, but it was adult. Judging from its teeth, it wasn't a young adult, but it was nulliparous. The uterus was very small. The body condition score was 9 out of 9, 10 out of 9 if they would have one, and it weighed about 1 3/4 kilograms. So it's a really small rabbit. The ration wasn't listed. There wasn't much history offered with this one. And basically, there was a minimal amount of autolytic change, which you wouldn't expect with a very fat animal. But so I suspect I got it very soon after death. A marked amount of fat stores, particularly in the abdominal fat stores. The blood was very thin and it wasn't clotting. Going along with blood that accumulates in the thoracic or abdominal cavities or both. If the animal has a short amount of time, it will become icterate due to reabsorption of the extravasated blood. And in this case, this rabbit had an empty GI tract, except for maybe in the last 10, 20 centimeters of the colon, 10 centimeters of the colon, 3 inches or so. There was some sort of very dry formed feces. Nothing unusual in anything except the GI tract was empty and the body fat stores were so tremendous. Again, the liver and kidney were very pale tan. The gallbladder was distended with semi-clotted bile, and the bile duct was patent. The clotted bile was kind of like kind of thick green fluid with some small strands of green clotted bile in it. The liver floated, like we talked about the last time, in the formalin. Let's see. Again, this is not my picture, but this is the mirror image of what I found this on the web to enhance our show here. But notice that the liver has kind of a raised, lumpy, bumpy appearance to it. It's diffuse pale tan to yellow. Gallbladders are really distended. And people always talk about gallbladders at necropsy, and they say, well, you know, the gallbladder was distended. Well, most of the times when an animal dies, it's anorexic. And for that reason, most everything that's presented to us has a distended gallbladder. Never fear, it could be blocked too. So it's not something to ignore, but it's something that we, as a habit, anything with a gallbladder pretty much has a distended gallbladder by the time it gets to the necropsy table. Again, there was no blockage of the bile duct. And this is the microscopic appearance of macro-vacuolar hepatopathy. With obese rabbits, the macro-vacuolar change is most prevalent. And the reason is because this condition, the macro-vacuolar, it's chronic. Smaller vesicles, you can imagine soap suds in your sink. You stir up the soap suds and they become small vesicles, and then they slowly coalesce over time. And that's precisely what happens in these diseased livers. It doesn't matter if it's cat liver or a rabbit liver or horse liver, they get like this with time. The puppies, different story. They don't develop this. They don't go this far as I was talking about with the stress to lipidosis in puppies. Now, again, I've outlined what I think is a good way to prevent this. Anorexia is the key in rabbits, as well as most other species, to this hepatic lipidosis thing. We have a decreased amount of protein coming in. The acyl carrier proteins are a very well conserved protein of most animal species. And these acyl carrier proteins, when they go down due to a protein deficiency, then carrying fat out of the liver becomes a problem. And this is where the methionine deficiency comes in, because that would be the rate limiting step to the production of these acyl carrier proteins. With these rabbits, particularly the ones that tend to be, to chow down at the bowl, a steady diet with a good appetite, maintenance of good health, and, keeping body condition score values kind of middle of the line, all important. And that's not just rabbits, that's all species. Beg pardon? Oh, okay. And then this is the overwhelming cause of lipidosis in rabbits, and that's obesity. The pregnancy, similar to pregnancy toxemia in sheep in particular, with multiple fetuses, they can become anorexic because there's no room to fill the stomach because the fetuses are taking over. Recent surgery with post-surgical anorexia, dental disease, and I checked this fellow. I'm learning to do that with rabbits because they have a lot of owners that don't realize that dental disease is a problem, and then gastrointestinal disease in general in rabbits can really upset the GI flora, and as a result, they become anorexic and the hepatic lipidosis develops. But overwhelming numbers of hepatic lipidosis cases, my understanding, is due to obesity. So with pet rabbits, on the increase, this is something certainly to watch out for. And that's it for that presentation.
Well, it looks like we're about out of time. It's almost 8 o'clock. Are there any questions or comments of anybody?
I was wondering for rabbits, like having a higher amount of roughage in the diet or things like that.
Yes, dietary roughage is important for all of these vegetarian animals. Quality hay, quality alfalfa hay, that type of thing, very important for these guys. And a lot of times, I don't know what they're eating, but treats and this type of thing. But I think more roughage is the key. But I'm not a nutritionist when it comes to something like that.
Are there any more questions?
Hey, John, this is Paul.
Yeah.
Hey, John, I want to just acknowledge, I was out of town for the Dr. Flint Taylor Memorial, but I want to acknowledge that, we all stand on the shoulders of giants. And I think Dr. Taylor, as the director of VDS, really set the stage for these kind of events. And I want to acknowledge that, he's one of my heroes.
Oh, thank you. Yeah, he really liked putting on CE events. So thank you for acknowledging that. Yeah.
Sure.
Any other questions or comments?
Thank you for doing this. We appreciate it.
Well,
thanks, John.
Thanks everybody for attending. And there's
Thank you, John.
There's one name here I don't recognize or have down. It's just listed as Laura. If that person can email me who was the attendee, and so they can get their CE certificate. It's not Dr. Sandlin. It's another name named Laura. And with that, I think we'll close down the shop, and everyone have a good evening.
You too, John.
Many thanks.
You're welcome.
Thank you, Dr. Ragsdale, for doing this again. And I didn't know hepatic lipidosis was in any species besides the cat. So I learned something tonight. Thank you.